welcome if you're just joining us. I hope that you can hear me okay. My name is Jennifer Falk. I'm the Director of Development at MS Views and News. And welcome everyone to MS NEURO TV, brought to you by MS Views and News. Tonight I'm here with our productions manager, Bill Shanley, who's doing and working all these beautiful graphics for us. Hi, Bill, if you're there.
How are you doing? Good to be here.
Great. Thank you, Bill. And just to give you all a little bit of background about MS Views and News, MS Views and News is a nonprofit organization dedicated to providing education and information to the multiple sclerosis community. And we are very honored and very happy to be doing that. And just to share with you all, this month, MS NEURO TV has reached over 1,000 people registered to this webinar series. So we are really excited. I think that's a big number, and I think it really speaks to the MS community and your drive to be involved, to be strong, to be empowered in your learning process through this journey with MS. So I feel I want to congratulate you all for being active in this and being part of this webinar and any other learning that you can access either virtually or live. I think you guys deserve a pat on the back because this is such awesome engagement to see. And this is why we do what we do, is to bring this information to you. So, thank you. And I think it's just so great. We'd also like to take a moment tonight to thank our supporters, Sanofi Genzyme and Celgene, and viewers like you for helping to make webinars like this series possible. Without the support of our sponsors and viewers, this would not be possible. So today also we'll be with Dr. Mitzi Williams, and she'll be sharing with us some great information on care partners. This is an important topic, and this topic definitely deserves a lot of attention. So just to give you some background on Dr. Mitzi Williams. Dr. Mitzi J. Williams is a neurologist and multiple sclerosis specialist in Atlanta, Georgia. She received her undergraduate degree in neuroscience and behavioral biology from Emory University and her Doctor of Medicine degree from Morehouse School of Medicine. Dr. Williams completed her internship and residency training in neurology, as well as clinical fellowship in multiple sclerosis at the Augusta University Medical Center in Augusta, Georgia. After several years of serving as the medical director of the Augusta MS Center and assistant professor in neurology, Dr. Williams returned to Atlanta, where she joined the staff of the Multiple Sclerosis Center of Atlanta. She served there as a staff physician and researcher for over 7 years. Dr. Williams has a strong interest in understanding and furthering research in MS in ethnic minority populations. She is a sought-after speaker and presenter and has discussed her research both nationally and internationally at various scientific meetings. She has spearheaded and participated in multiple steering committees and work groups to further research in underserved populations living with multiple sclerosis, with a focus on the African American population. Dr. Williams is the author of a book called MS Made Simple: The Essential Guide to Understanding Your Multiple Sclerosis Diagnosis. And if you guys haven't gotten this book, it's a great book. I think you should check that one out. Again, the title of the book is MS Made Simple: The Essential Guide to Understanding Your Multiple Sclerosis Diagnosis. Dr. Williams continues to educate patients and colleagues about self-advocacy and the importance of shared decision-making between patients and their healthcare teams. So we are very honored to have Dr. Williams joining us tonight. And I think this is a wonderful opportunity for all of you on the line to get your questions ready, start thinking about it, and what you would like to ask Dr. Williams about care partners and living with multiple sclerosis. And I think we are ready to start our pre-recorded video. But before we begin, I do want you to know that if you're on the phone and you don't have computer access, you will not be able to see the video portion. Okay, so you won't be able to see or hear anything for the approximately 11 minutes, unfortunately, that you will be on the line. But stay on the line because you will be able to join us again and participate with the questions and answers live with Dr. Williams. Okay, so let's begin our video. NEURO TV, presented by MS Views and News. MS NEURO TV is a comprehensive educational program bringing together MS professionals from across the United States covering the topics that you want to learn more about. To register for MS NEURO TV webinars, visit www.msviewsandnews.org. Thank you. We hope you enjoy the program.
Hi, this is Stuart Schlossman, and I'm here again for MS NEURO TV. And today we have Dr. Mitzi Williams from Atlanta joining us, and we would like to speak with Mitzi about care partners in multiple sclerosis, an important discussion on self-care, relationships, and communication. And so, firstly, I would like to speak with you about, like, when a family member is living with a chronic illness, there's often a shift in roles, not only for someone's partner, but for all the family members or everybody in the family unit, as MS is a family-affected syndrome or disease. What do you say about that?
Absolutely. Well, thank you so much for having me. It's a pleasure being here with you and talking a little bit about multiple sclerosis, which is a condition that I'm very passionate about, and I'm very passionate about the people that I serve on a regular basis. So when we talk about the shifting of roles, it really depends on the type of symptoms that a person has and where they are in the course of MS. For instance, there are some people who are very early on in disease that may not really have any symptoms from their MS. However, sometimes people will get to a point where they may have a shift, they may have a bad relapse that may result in some disability, or even if they have a relapse that has temporary disability, it can affect their ability to function in their everyday roles. It's important that people recognize that sometimes with MS, you have to develop a new normal. So I like to say when counseling my patients that MS is not a death sentence, but it could be an adjustment sentence. So we may have to adjust at different points of the disease, our roles and our ways that we envision ourselves in our everyday life, as well as the roles of those around us. So when it comes to care partners, again, the roles can shift. There are some cases where people may go through a period where they have a lot of disability from their MS, and those care partners may have to increase their roles in terms of household duties. Sometimes that's difficult, especially if it is a woman who has a family, a husband and a child or children, and they're used to taking care of the home or doing certain things. It can be difficult for them to not be able to do those things as adequately and to ask for help. Also, it's important when those roles shift, sometimes people have to ask other family members to help. So for instance, some of my patients, if they are going through a period of symptoms, may have to have a parent, a mother or a sister, a sibling come and live with them to help with some of those everyday activities. And depending on the level of disability, they may have to have other outside help from like a home health agency. So when you talk about partnership, it really is a partnership, and those roles are sometimes constantly shifting. There may be a period where someone may need extra help, and then once the symptoms improve, they may go back to some of their baseline, or there may be permanent changes in those roles of family members and friends.
So that being said, now the patient is afraid to ask their husband or wife
Mm-hmm.
or their child for this kind of assistance.
Mm-hmm.
How does your center help get that communication going with the family unit?
Absolutely, great question. I think the most important thing is education, right? I tell everyone that I encounter that everybody needs a little help sometimes. And I don't feel that it's right for people to kind of suffer in silence and try to take on everything without asking for help. Something that really facilitates the conversation is having a family member come to a visit, because oftentimes they will have concerns that they may bring out, and the doctor's visit can provide a forum for them to discuss those things. Other things that are very important depending on where they are in the course of disease is sometimes counseling. Sometimes when people go to counseling, that can bring up issues and allow people to freely discuss their concerns, their fears, the difficulty asking for help in a very open and kind of objective forum to try to solve and find solutions for those issues.
So going further, now there's a patient that knows that they're having difficulty,
Mm-hmm.
but will not accept the help from their care partner.
Mm-hmm.
How do you get that patient to understand that they really should accept that assistance?
It again takes patience, right? It takes
Sure.
patience, and it takes time, and it takes continued efforts at educating and normalizing, right? So I tell, folks, one of the difficulties, and MS does affect many women, it also affects men, obviously, but sometimes for women we have this superwoman complex.
Sure.
And so it's very difficult for us to take off our superwoman cape and admit that we need help. And so what I try to do is normalize that. And what I do is I describe the situation. I say, if your girlfriend walked up to you and said, I've got this disease, I'm having these problems, I can't do this, I can't do that, you would probably say to them, you need some help. But when it's us, or when it's that individual, we say, well, I can do it, I don't need any help. And so I try to kind of reverse those roles, continue to educate, and recognize that you can't necessarily change however many years of behavior and thought process in one visit, right? So it takes patience, and sometimes it will take a while, but people will come to that realization.
Sure, thank you. What can you tell us about care partner guilt?
Mm-hmm. So care partner guilt is a big issue, I think. And I think that sometimes it really depends on the situation. So for instance, sometimes people will be having difficulty and may not tell a care partner, and that person may feel guilty because they didn't recognize it. Or sometimes a person may be having an issue that's under-recognized as a symptom of MS, right? There are many silent symptoms of MS like
Sure.
fatigue, cognitive difficulty, that people can mistake as behaviors, right? So if someone is fatigued, a care partner could mistake that as a person being lazy, right? Or if someone is having cognitive difficulty, a care partner could mistake that as someone not paying attention. And so I think that sometimes people do have guilt because if those symptoms progress and they come to a visit and we recognize that person's MS is getting worse, they may feel guilty that they missed it, or that they mistook those things as behaviors versus symptoms of the actual disease.
Sure, thank you. How can you share with us the importance of managing the shift and finding things in common for people in the family unit to do things together?
Mm-hmm. So I think that, again, knowing is half the battle. One
Right.
of my old favorite cartoons, G.I. Joe, they say knowing is half the battle. So I think that educating and making sure that people are aware of the symptoms and signs of MS and of kind of the different roles that people play is important. And I think that honestly, when you talk about the shift in roles, that could happen with any relationship, even independent of MS. People go through different stages of life. They may develop other conditions besides MS, like cancer or other illnesses. And so there sometimes is a natural shift just depending on where people are in life. So continuing to work at it, continuing to work with physicians and doctors, also continuing to work with other professionals if counseling is needed, and being open and honest in communication will help with that adjustment.
Great. Can you tell us about self-care and how that can help others as well?
Absolutely. So I tell every one of my patients, if you don't take care of yourself, you can't take care of anybody else, right? And so many of our patients are responsible for different people. They may have children, they may have spouses, they may be managers at work, and they have a lot of responsibilities. But again, it's important to emphasize that you have to take care of yourself so that you can be in a good frame of mind and a good mindset to perform your regular duties and to take care of other people. And that can look different ways for different people. So for some people, taking care of themselves might be going to the spa, or might be going away for a couple of days, or might be getting a little downtime and missing, maybe some other activities. So I stress the importance of making sure that you're taking care of yourself, because if you don't, it could lead you to have symptoms worsening of MS, right? So if we talk about stress, depression, or anxiety, many of those issues can come from people not taking that regular time to take care of themselves, and can worsen their MS symptoms.
Right. Thank you for that. Are there any resources that you could recommend for the MS patients and their care partners?
Absolutely. So I think that it is important that people direct themselves, or are directed to, solid sources of information. There's a lot of information out there, especially on the internet. And I have lots of folks that give themselves medical degrees on Google. So, it is important that even if you're Googling, right, which it's important to kind of keep yourself educated and keep yourself aware, to make sure that you're getting very good information. So there are sites such as MS Views and News, right? You guys have great information about MS. And then there are also other sites through our foundations, right? So through the MS Coalition Partners, the National MS Society, the MS Foundation, the MS Association of America. And there are also local resources that people can look into. And so I often direct them to those sites, because the information is usually backed by science, and people have looked at that and reviewed it before they post it out to the public.
That's great. Going locally, though, for an area where are there any support groups that you know of, or things that people could do within a community or online where they can be together as a family unit?
Absolutely. So when we talk about support groups, there are different support groups. Now, I have found that there is not as much support for care partners.
Sure.
So that's an area that definitely needs some work. But generally, if you look or direct people to sites like the MS Society or the MS Foundation, they often have a list of support groups in different parts of the country. And so I often tell folks, if you don't know of a support group in your area, you can call your local chapter, and they can tell you about support groups in different parts of the city. And if there's a need, then maybe you're the person to start that group yourself.
Maybe. Dr. Williams, thank you for being here today.
Absolutely. It's my pleasure.
Perfect.
All right,
Have a great day.
Thank you.
Okay, and welcome back, everyone. I hope you enjoyed that video as much as we did. And thank you, Stuart and Dr. Mitzi, for giving us such solid information and just making this topic so relatable. So now it's your turn, everyone in the audience, to start writing out your questions. I hope that you can see the question box. You should see it, a little orange or red arrow on the right-hand corner of your screen. If you hit that arrow, it should make the question box available to you. And you are welcome to start typing your questions. And I say this every month, no question is silly. No question should not be asked, because it may not just be your question. As I said earlier, we have over 1,000 people registered, and that's not just in the United States. We actually have people joining us from Australia, from South Africa, from Italy. So the people all over the world that can join us and hear you and hear your questions and concerns or advice or recommendations. So we embrace and love that you share this with us, and I will try to share as much as I can. As you type them in, I will be reading them to Dr. Williams. So welcome, Dr. Williams. How are you?
I'm doing great. How are you? I'm very glad to be here. Thank you for having me again.
Terrific. Thank you for being with us again. We're so honored to have you join us. And we have a lot of questions coming in. I think care partners and people close to people living with MS and affected by it sometimes don't get as much attention. And I think it's an important topic, tonight's topic. Yeah.
Absolutely.
So I'm going to share some of the questions that we have coming in.
All right, let's go.
Okay, let's see here. So I have someone asking, how do I explain my silent symptoms to my partner to really make them understand? Do you have any recommendations for that?
Absolutely. So silent symptoms, as we discussed a little bit or touched on a little bit in the video, are really difficult for people to grasp in terms of, the amount of disability and the interference with your daily function that they can cause. I think that certainly one of the things that's been very effective in my practice is actually having the care partners, if possible, either come to a doctor's visit and we discuss them together at the doctor's visit, or sometimes I'll have people call in or even sometimes FaceTime with their care partners so that they can hear not just from you, even though, when you explain it, it can certainly be effective. But I think it's important for them to recognize that they are symptoms that occur with other people. I think also if you have other family members or friends who have care partners and you guys have any relationship with them, sometimes it's also helpful for your care partner to understand that these same symptoms or same issues are happening in other people. So to answer the question, to explain them, I think, you try to explain them to the best of your ability. There certainly are resources through the MS Society that describe some of those silent symptoms, some of our other organizations such as MS Views and News as well. I also talked a little bit about some of these symptoms in my book, but there's certainly resources that you can look at online to help explain, but I do think it's very effective to actually have them come to a visit or interact with your healthcare team to recognize that this is something that not only happens to you, but happens to many people with MS, and that can help explain it to them so they can understand.
Oh, such great advice. Thank you. And that's a little bit close to this is someone is asking, I have not really told anyone that I have MS, but my family, my friends do not know. Do you encourage your patients to be open about their condition?
Right. So I do encourage people. So the disclosure of a diagnosis and who people disclose to is very different and a very individual decision for each person. I think that one of the major issues we run into is not disclosure with family and friends necessarily, but disclosures for work. And that's something that I really kind of sit down and counsel people about. And it is really their decision to be open about that or not. But in terms of family and friends, I do recommend that people are open with their family and friends because they can often be a very good source of support for that person, whether it's emotional support or in some cases, if there are relapses that cause significant symptoms, they can be physical support in terms of helping with duties and other things like that. So I do encourage people to be open because a support network consisting of family and friends is very important, not just when you're having problems and actual significant disability from your MS, but also in the times where things may be relatively normal. So having that support network is extremely important. So letting friends and families know, of course, at your comfort level about the diagnosis can certainly increase that support network.
Oh, great. Thank you. And I do have someone that is asking, as a care partner, and this sounds more in the category of self-care, as a care partner, I also have my own health issues, which I tend to neglect. What do you recommend to partners as you work in your practice in terms of taking care of yourself?
Right. So it certainly can be difficult to balance caring for yourself and helping care for someone else. Again, that's why it's important to have a network where possible, right? So that all of the responsibility does not necessarily fall on one person, and that there are other resources and other friends or family members or others who can help if you need to take care of yourself. So I always tell people you can't take care of someone else if you're not taking care of yourself. So you have to have those times where you can go to your own doctor's visits, address some of those health issues, sometimes get some rest or things like that. So that's why the network is so important. So not just everything depending on one person, but kind of engaging again, the best word I can think of is network, but engaging those other friends and family members to help kind of share some of that responsibility, especially if you need that time to do things to take care of yourself.
Yeah, and it's so important to have that balance.
Yeah,
and
absolutely.
I hear this in the next question, and this person is saying, as a care partner, I often feel bad when I want to continue with a hobby that I enjoy, like working out or playing tennis. I know my partner can no longer participate in the way that she used to. Any suggestions? I imagine that that's a common problem, that people face.
Yeah, so I think so, absolutely. I think that certainly there can be, and we talked a little bit about care partner guilt as well. Feeling bad that you can continue to do that things and your loved one can't necessarily do those things. But I think that, in that case, it's important to have a discussion with that person. And 9 times out of 10, most of my patients would want their partner to continue to do things that they enjoy, And one other thing that can be considered is maybe developing new hobbies together, so that even if you continue some of those old hobbies, maybe you develop a new hobby together so that there's something else to maybe replace one of those old activities that your loved one can no longer participate in.
That's terrific. Absolutely. And I have a few questions. This is interesting. Do you see care partners developing symptoms similar to their partners with MS, like heat intolerance or pain or insomnia?
Right. So not commonly. So it doesn't work quite like pregnancy. My husband always told me that I gave him a sweet tooth when I was pregnant, although I think he had one from the start. But so it doesn't quite work like that. I don't commonly have care partners that develop the same symptoms as people living with MS. But one thing to keep in mind is that if they do, symptoms of MS are very common to many other diseases, right? So some of the symptoms can be related to conditions like diabetes or high blood pressure. So people may have similar symptoms just because the symptoms of MS are very common to other conditions. But I don't necessarily have people kind of develop those symptoms like, kind of what we talk about with pregnancy where, the husband may develop some of the same symptoms as the wife. I don't see that very commonly.
Wow. Okay. And
great question, though.
Yeah, it is. Maybe sympathy, pain. As a care partner, I struggle. This person is saying they struggle with feeling isolated and they struggle with clinical depression. Although I have read that this is quite common, can you offer any suggestions for finding balance in my role, still maintaining identity as my own person?
Right. And so it's difficult, right? And there's not a one size fits all for everyone because, again, there are some people who need different levels of support, in partnership with their MS. There are some people who are able to do quite a few things and may need more emotional support. And there are some people who are not able to do very much and may need significant emotional and physical support. I think that, again, the important things are kind of carving out some of that time for yourself to take care of yourself and looking at the resources available. In some cases, that support network may be other family members and friends or children or siblings. In other cases, that support network may be looking at options with your healthcare team, such as home health providers, or nurses who can come to the home or home health aides. So and then there are also in some cases what we call respite care, where someone may need to take care of things and they may have a place or a program, a day program that their loved one can go to so that they can run some of their errands and do things which is not necessarily the same as like, putting someone in, a nursing home or something like that, so to speak. So there are lots of different options, but I think the first key is to ask for help, right? We cannot help solve a problem that someone doesn't necessarily admit exists. So the first thing is to reach out and ask for help. And there are often many resources available so that you can kind of get a little bit of that time to maintain some of your identity or do some of those hobbies, or even get time to do simple things like take care of your own physical health.
Yeah, it's super important. And I know
Absolutely.
you mentioned during your interview with Stuart, as a woman, that it's hard sometimes to not be superwoman. And one of our questions here is saying it's so hard to give up control. How do you surrender that? How do you just ask for help? And it's really speaks to what you're saying. It's just to learn. Yeah.
Right. So it's not easy. It's not easy, but it's necessary, right? And again, so these principles can apply to people who have loved ones who may have Alzheimer's. It can apply to a mother who has children and has a full-time job, right? So these are things or situations that can arise in many different aspects of our lives for people who do and do not have MS, right? But again, you have to look at the things that, you are able to do, and be realistic. And one of the things that I try to encourage my patients to understand is that MS is very different from other conditions. So, our society kind of pushes us, to keep going and keep going, I say, until you pass out. So no pain, no gain. But with MS, you wind up paying for it on the back end, right? So if you overdo and overdo and overdo, you might be down for 3 or 4 days, right? So you might lose a week after trying to do too much activity. So balance is extremely important for people who are living with multiple sclerosis, because there can be consequences if you really overdo it. So it really is a process of just kind of recognizing where you are, and also recognizing that it is okay to ask for help. And that there's nothing wrong with asking for help if you need it. So some people can get that through counseling and things like that. Some people do, unfortunately, have to learn the hard way and have a rough time, over and over again with those periods of super activity followed by, kind of not feeling well. But I think that over time, most people get it, but it's really about just kind of being realistic where you are and realizing that it is not bad, and it has nothing to do with any person's self-worth or their value by asking for help, that it really is okay to ask for help.
It's wonderful advice. And I think it's just the learning how to reframe that in your mind.
It is.
And
balance that. Absolutely. Yeah. Absolutely. Absolutely. And it's a process, right? So recognize that if you're diagnosed with MS at age 30 or 40, or you're doing well, thought processes often don't change overnight. So we also have to give ourselves some grace, because everything does not change overnight. And sometimes it takes some time for us to kind of work on those mindset things.
Oh, so well said. Thank you. I think this next person, and I think it seems like there's a lot of anxiety about the future and care partner.
Yeah.
This person is saying that my MS is not disabling right now, and my care partner has not really had to provide much support, but she fears that when the time comes, she may not receive the support that she needs, and she's wondering, is that a common something common that you see in your practice, where I don't know that the care partner is not able to provide the needed support?
Yeah, so I have heard a few of my patients say that it is not as common an issue as you would think. I think that more often people are just worried kind of about the future and how they will do. I think that my approach and what I encourage my patients to do is that we cross every bridge when we get to it. And some bridges we may never have to cross. So I'll give you an example. I had a patient who was doing well, was just diagnosed, was absolutely fine, absolutely no disability, but was building a house and questioned if they should build an elevator in their house. you know. And so we
Right.
had kind of a discussion surrounding that and saying, you know, at this point in time, you are doing absolutely normally. I can't predict what may happen, but we may get 10 years down the line and you're still walking absolutely normally. Now, if you just want an elevator for the heck of it, go for it. But if we continue to kind of live with that, you know, absolute fear, then, you know, there will likely be things that we have worried and feared about that never happened. And we've wasted our good time worrying about things that didn't happen, you know. And then if they do happen, we've still wasted our good time and our good function worried about something that, you know, eventually happen. So we cross every bridge when we get to it. I think, again, having your care partner involved with your healthcare team and being involved in those visits and kind of being a part of the MS community kind of helps people understand how the disease can be, you know, potentially, but also kind of understand the dynamics a little bit better to help if there is a transition to more significant disability.
Oh, terrific, terrific advice. Thank you so much.
Absolutely.
We have someone asking, is there financial support for an outside caregiver? So someone who's giving care, I guess they're looking for financial support to pay for maybe home health or for maybe a private caregiver. Any resources?
Yeah, so every you know, type of insurance is different. There are some that do provide home health services and home health aides. There really are not insurances that provide for like what we would call a sitter, like someone that will sit with you or, you know, be with your care partner for like half of the day or 12 hours a day or 24 hours a day. Those types of things aren't really provided through insurance. Sometimes there are resources available through, you know, charity organizations where they may provide, as I said, some respite care, you know, but that's usually very short term. So the short answer is I'm not aware. So the short answer is I'm not aware of resources that will provide for someone to sit for extended periods of time.
No, I'm not either. And I'm coming from a social work perspective. As a social worker, I know that in some communities there are people, you can reach out to your local church or synagogue and see that some people will come and help and either help with caregiving or help relieve a caregiver that needs to take a break or help with food shopping. And, you know, we have the MS Society, we have the MS Foundation that sometimes can provide. I think the United Way is also an overlooked resource for our MS community. And I definitely encourage people that are looking for any kind of financial assistance or just assistance in any way to also check out the United Way, which is an excellent resource. And you just have to dial 211 and they will ask all your details and they can offer what's out there. They really have a really big resource list, so that could be something also.
Yeah, that's great. That's great.
Yeah. So, well, Dr. Williams, this has been excellent. Thank you so much for sharing all of your knowledge, your experience, and making this so relatable for everyone. This has been wonderful. Thank you so much.
Thank you. Absolutely. Thank you for having me, and thank you everyone for joining us. And I hope that this was helpful. And I look forward to working with you guys again.
Excellent. Thank you. Thanks so much. So in conclusion, you know, we really appreciate that you were here with us tonight. We appreciate Dr. Williams joining us. We will be sending you all a 1-minute survey that will appear after the webinar is finished. I read all of your feedback, positive, negative, and in between. It's important to us so we can continue to tailor these events and these programs around you. We really do value your feedback. So if you could fill out those surveys, we really appreciate it. And please remember, next month is also a very interesting topic, Social Security Disability Law with Lisa Gonzalez-Getz, who is a Social Security disability attorney, and she specializes and works with people living with multiple sclerosis. So next month's webinar topic is also an excellent topic, and I hope that you all can join us. This webinar will be next Tuesday, October 1st, 8 p.m. And if you're joining us tonight, you're already registered, so you don't have to do anything more. You'll be sent reminder emails and instructions on how to join that next webinar on Social Security disability law. And if you're watching us on YouTube and you're not registered for this series yet, you can find the registration link in the video on the YouTube description. All of our MS Neuro TV webinars, including tonight's, are recorded. I know a lot of you email me afterwards because you missed it, and that's okay because you can find it on our YouTube Learning channel within the next couple of weeks. And I'll always send you the link, so if you missed it, don't worry. And please remember to subscribe to the YouTube Learning channel. And you can turn on notifications and you'll get alerts every time MS Views and News posts a new educational video or a new webinar. So I definitely encourage you guys to subscribe to the MS Views and News YouTube Learning channel. Okay, and if you are enjoying these webinars, visit our website, sign up to receive notifications at www.msviewsandnews.org. And remember to follow our Facebook and Instagram and Twitter family. We have a lot of fun there and we have good conversations there as well. And we also like to close the night to thank Sanofi Genzyme and Celgene and viewers like you. Thank you again for your ongoing support and for making programs like tonight possible. Have a good month, everyone. I'll see you next month and hope you enjoyed tonight. Thank you. Bye-bye.